Welcome to the oral pathology sessions here. Today we are going to discuss a small topic on Kaposi sarcoma. Okay, Kaposi sarcoma is actually a AIDS related lesion. Okay, so AIDS related lesion and Kaposi sarcoma has been asked for as a short note in your university examinations. Okay, oral manifestation of AIDS as well as Kaposi sarcomas are very important area in your exam. Okay, so let's discuss a little about of Kaposi sarcoma. Okay, oral manifestation of AIDS is a very important short essay that will be discussed in another video. In this video, we will be discussing about Kaposi sarcoma. So here, see in this picture, you are seeing reddish areas of this patient on the face. Okay, they are nothing but some vascular defects or vascular problems. So Kaposi sarcoma is something related to blood vessels. Okay, now let's see what's there in Kaposi sarcoma. Starting with our content page, that is the introduction, etiology, what is the reason for Kaposi sarcoma, the classification, the clinical and histological features, and the treatment options in Kaposi sarcoma. Now, Kaposi sarcoma is a vascular neoplasm. It's an unusual vascular neoplasm and it is mostly associated with HIV. It is a common lesion seen in HIV patients. Okay, Kaposi sarcoma is a vascular neoplasm or blood vessel related neoplasm that is seen in HIV patients. Now let's see how. The main reason for this Kaposi sarcoma, it is seen in HIV patient, but it is not due to retrovirus. It is due to human herpes virus 8, your HHV8. Very important that you should remember that Kaposi sarcoma, that is a vascular neoplasm in which HHV8 human herpes virus will affect or infect the endothelial cells and cause Kaposi sarcoma. Okay, so that is the main reason for your Kaposi sarcoma. It is seen in AIDS patients. Okay, it is seen in AIDS patients because of the immunocompromised state. Okay, it is the patient in an immunocompromised state will get an infection by the HHV8 virus and the cause result in Kaposi sarcoma. So this is how Kaposi sarcoma occurs. Okay, now it can be classified into four. You should remember the names of all the classifications. That is a classical variant, endemic variant. I have told you endemic means to a part of an area or to a geographic area which is common or localized to a common area. That's endemic. Mainly it is related to the African population. So there's a classical Kaposi sarcoma, there's an endemic form of Kaposi sarcoma. Iatrogenic means transplant associated, means when the patient is undergoing a transplantation, kidney transplant or your heart transplant, the patient's immunity will be reduced by immunosuppressive drugs, right? So in that condition, immunosuppressive agents are given to facilitate this transplantation. So the patient will go through an immunosuppressed or immunosuppressed state. So at that time, there's a chance that the patient can get Kaposi sarcoma, that is called iatrogenic Kaposi sarcoma, and one is epidemic. Okay, that is AIDS related Kaposi sarcoma. So Kaposi sarcoma can be classic, endemic, iatrogenic, and epidemic. Epidemic means an infection, right? So AIDS infection related. Now let's see what's there in the classical type. Just the basic outline of what's there in the classical type. The classical type mostly occurs in the adult male population, and can you see this image? You are seeing so many blue purple macules, okay, or reddish purple blue macules, and mostly on the skin of the your leg, okay, or your hand, okay, and in the oral lesions mostly commonly seen in the palate. So that is a classical Kaposi sarcoma. In the endemic type, you know that it is more related to African population, okay, mostly in adult and children in the African population, and it is very aggressive also, but it does not involve the skin much. It is mostly involving the lymph nodes, okay, it is mostly involving the lymph nodes, and skin involvement is very less. That is endemic type. Now coming to iatrogenic type, you know that how iatrogenic type occurs. It is due to immunosuppressant, due to immunosuppressive therapy during organ transplants. and it is more aggressive also. Okay, it's very aggressive. Coming to the epidemic type, which is related to AIDS, because it occur only in patients with AIDS. Okay, and it is the most aggressive of all subtypes. Which is the most aggressive one? Anyway, Kaposi sarcoma is aggressive. There is classic, endemic, iatrogenic, and epidemic type. Epidemic type, or which is associated with AIDS, is the most aggressive one. Okay, now if you see the histopathology of Kaposi sarcoma has two stages. Okay, the stages of Kaposi sarcoma. The first stage is called patch stage. In patch stage, you are seeing red purple macules. Okay, and dilated blood vessels. Okay, that is called a patch stage. You are showing seeing some red purple macules or patches. Okay, small elevated lesions on the skin. Now, next come is the plaque stage. So, patch to plaque. Okay, now in plaque stage, what happens? It is thickened, okay, more thick stage, and there is more amount of vascular channels, okay, or compressed vascular channels. The vascular channels are compressed to form slit like. You will see slit like spaces. I will show you the histograph. And the last stage is the nodular stage. So first one is the patch stage, then the plaque stage, and the nodular stage. In the nodular stage, you are seeing nodules or growth. Okay, nodule like growth like this on the skin. Okay, and that is formed by spindle cells. What are these spindle cells? They are nothing but endothelial cells. And you see a slit like or sieve like spaces. Okay, the blood vessels, these spaces are nothing but blood vessels. I will show the histogram. See, you are seeing a lot of endothelial cells with slit like or sleeve like spaces. You see a lot of spaces here. Okay, they are nothing but your slit like spaces. Okay, that's what you see in Kaposi sarcoma. You should know the four variants. Okay, it is caused by HHV8. There are four variants: classical, endemic, iatrogenic, and the epidemic. Out of which epidemic is more aggressive. The histological stage has three stages. That is a patch stage, the plaque stage, and the nodular stage. That is a patch stage. It is a flat lesion. Plaque stage, it is more thick. Nodule, it is more nodular. Okay, so it is growing from one to another. Now, how you treat Kaposi sarcoma? Kaposi sarcoma can be treated by surgical removal and radiation therapy. Okay. Surgical removal and radiation therapy. Sometimes you can give injections of certain anti-cancer drugs. Okay, chemotherapy drugs can be injected into the lesion. Okay, that is intralesional injection of vinblastine. Okay, and the survival is nearly 10 to 15 years. It is very aggressive. Okay, and that's the treatment of Kaposi sarcoma. So this is about Kaposi sarcoma. Thank you.